Hi, I'm Heide Hestermann, Corporate Marketing Manager at BIOTRONIK, and in this function responsible for the CRT and tachycardia devices at BIOTRONIK. With me today is Dr. Ilka Neumann, who leads the global training education programs at BIOTRONIK in the cardiac rhythm management area. Welcome, Ilka.
Hello, Heide. It's a pleasure for me to be here today. Thanks for inviting me.
So, why are we here today? At BIOTRONIK, we are strongly devoted to providing optimal cardiac resynchronization therapy for heart failure patients. And that includes not only our MR conditioned CRT devices, but also our remarkable BIOTRONIK home monitoring technology. Today, we would like to focus on another technology, specifically aiming to improve CRT response from BIOTRONIK, which is called MultiPole Pacing. Ilka, can you briefly explain to us what MultiPole Pacing is about?
Yeah, sure. One of the remaining issues in CRT is reducing the non-responder rates. Studies show that there is currently a 30 to 40% non-responder rate to CRT.
Which shows that it's really an important matter in CRT.
Yes, indeed. And taking the importance of this matter into account, we are talking about very, very sick patients here. MultiPole pacing is a pacing technology made available in BIOTRONIK CRT-Ds that has been specifically designed as an option to increase CRT response. Basically, instead of using just one impulse on the LV, two impulses are used, which means that you start to depolarize the left ventricle from the two spots instead of just one, giving you the opportunities to speed up the depolarization.
Actually, to me, this sounds also more like the natural conduction system of the heart, because if you look at the Purkinje fiber, the tree kind of structure, you also pace the heart from multiple sides. So it's not surprising to me that this approach helps to speed up the depolarization.
Yes, indeed. And by doing so, by speeding up the depolarization, particularly of the left ventricle, hemodynamics can be improved. And as a consequence, CRT response too. Obviously, this is a valuable option for non-responders, but it may also be interesting for responders. Some of them might actually turn into super responders.
That's very interesting, and considering that this technology has these potential benefits, I wonder, why is it not used for every patient?
Yeah, that's a good question. From my experience, the major concern is really the impact on device longevity. Providing a second impulse causes additional battery drain.
So when we implemented MultiPole pacing, we were interested how MultiPole pacing would perform in our devices and in a real life setting. And therefore, we looked at 3 of our trials, the DIA4 master trial, IPERA master trial, and QPXL, to retrieve what are realistic values for pacing amplitudes in a real life setting. And this is actually what you can see in the table here.
This is a calculation where exactly these realistic settings were used. Note that the required pacing amplitude is higher at the proximal part of the LV lead than at the distal part of it. And here the proximal part is 3.2 volts for LV3, and it's much lower at the distal part, and this is logical because typically at the distal part the target vein is thinning out towards its end, pressing the electrode closer to the muscle tissue.
Which probably explains why this approach is very frequently chosen in real life. And this is what you can see in the table here. The pacing amplitude for this approach is just 2.0 volt, resulting in an excellent longevity of 8.9 years, which is very high for CRT. I guess you could call it a battery optimized approach. However, how does that help you if CRT response is unsatisfactory with your patient, right? So the second step, or the next step of optimization would be to go for a more proximal spot in the heart, like the LV3, for example.
Yes, and the reason for that is that the more proximal poles tend to be closer to the area of latest activation, and this is the area we are aiming for in CRT. And of course, if you want to measure that electrically, you can simply use RV LV conduction time to individualize your pacing site selection.
So, like in this case, we would, for example, go to LV3, which is more proximal, and that would be a more hemodynamic approach. What we see, though, is that the battery goes down significantly to 7.8 years, so that's a difference. However, I think that 7.8 years is still a very good longevity for CRT.
It is still very good. Now, let's see what happens if we use exactly these settings to turn on multiple pacing. And as you can see, the longevity changes from 7.8 to 7.5 years. And one may wonder why it is such a small difference. But actually, it is such a small difference because adding the distal pole as a pacing site does not cause high battery drain, as we have learned.
Exactly, and that's because it uses just the 2.0 pacing, 2.0 volt pacing amplitude, right? So I guess you could say that if we compare multiple pacing to a hemodynamic approach rather than a battery optimized one, the resulting drain of battery is just 4%.
Exactly.
Wow, just 4% battery drain. I have to say that really makes using multiple pacing an easier decision to make. So Ilka, let's say we have a patient with a high amount of ischemia on the left ventricle, and we know that this is a risk factor for CRT response, and it may be limited. Yeah. So therefore we are considering to use multiple pacing in the future. What should we watch out for?
Multiple pacing is not a guarantee for therapy success per se. It's not about the feature, it's about the way it is set up. The two stimulation sites need to be somewhat distant from each other. And the idea is to depolarize a larger area in a given time.
Which means then that if the pole spacing matters, actually the choice of the LV lead matters, because that is what defines the pole spacing. And that's very good for us because we actually have the lead with the longest pole spacing on the market, right?
Yeah, indeed it is, but it's not only that. In case the first pole, LV1, the most distal one, drops out due to phrenic nerve stimulation or non-capture, you will still have a reasonable distance left between LV2 and LV4. And this is a big advantage with BIOTRONIK LV leads.
Okay, so to summarize, multiple pacing is actually not a device function, it's a system function, and therefore the LV lead plays a vital role in its success.
Yes, absolutely.
Thank you very much for this informative talk. So today we learned about the energy efficiency of BIOTRONIK's multiple pacing, as well as the vital role that the LV lead plays for its success. Is there anything you would like to add?
Yes. In the end, even with multiple pacing, there's never a guarantee for therapy success. But let's all remember that we are here to make lives of very, very sick patients better. And all of us can help to make sure they get the best options available to them.
And I have to say my absolute favorite here is BIOTRONIK home monitoring, because it gives you the opportunity to reduce mortality by more than 50% if you use the in-time approach. And I find that really remarkable. Yeah. Thank you very much for this informative talk. It was a pleasure to have you here, Ilka, and I hope I see you again soon.
Thank you, Heide.